we had a conversation both about the General Assistance Medical Care Bill and its timeline, and we will be moving forward with that this week, as we have been committed to. And we also had a conversation about the opportunity for medical assistance and early expansion for those served currently in GAMC, and we are going to continue to work on that. The administration has expressed an openness to that, and we have to understand a little more about what is in the federal proposal and the timelines, but we're going to continue to pursue that this session, and I think that's a good piece of news for Minnesotans, both for the taxpayers and for Minnesota providers, and certainly the people enrolled in general assistance medical care.
When are you going to vote in the House after?
We'll take the bill up either today or tomorrow.
Do you guys agree, at least now, on the numbers of the federal health care impact on Minnesota's budget? Is there
well, I think I went over the numbers that I have with Commissioner Hansen, and he seemed to understand how we arrived at the number and agreed it was probably correct.
And there is there is a problem in the tails, and we knew that when I talked the other day. I was talking about fiscal year 2011, and we all agree that there are savings for the early enrollment in this fiscal year, and we always knew that there would be problems with the tails, and both the governor and the Senate and the House will be working on some way to lower the tail cost.
The speaker had said last night that you maybe had some ideas as to how to drive down some of those costs in the tails. Was that discussed at all today?
Oh, the speaker never talked to me about that. So
we did talk briefly today about some of our ideas, but I think that there is more to understand about what's in the Senate bill that's been signed by the president, and then we need to get our pencils out and make sure that the numbers that we're getting from DHS are accurate. I think that the preliminary numbers that we got from them are probably a little in error, and so I think as we move forward, understanding better what's been passed, we'll be able to work creatively on the tails issue.
You know, one of the things that isn't clear about the federal bill is whether you bring people into your state's Medicaid program as it exists, or whether the program you have can get Medicaid funding. And it makes a big difference as to which you would be able to do as to what the numbers would be. The numbers that I have right now and the numbers that we shared with the governor and Commissioner Hansen are based on moving people into our existing program. But that may not be our only option.
So is there a consensus that whatever the number is, that there will be some positive benefit for plugging the deficit this year with that federal money?
That's true, but you can't just enroll people in Medicaid for a year. So then there are tails issues that need to be dealt with, and I think that's part of the work that needs to be done over the next couple of weeks.
Do you agree on how much it would help this in the current biennium? Is it 14 million or 60 million? Or is there any...
Well, we didn't talk about that. It was more of a concern about tails, but you know, whatever the savings are this biennium because of this, you know, would be rolled over into the next biennium to help with that problem.
President Murphy, what kind of pushback are you getting from rural members on the impact of the current deal on their hospitals?
I think that I'm hearing from rural members, they have concerns about their ability to provide care, especially those in sort of our regional population centers, contemplating their role as a CCO and trying to understand that. We did request that DHS meet with and work with those providers so they have a better understanding of the expectations, and that work is already underway. The Department of Human Services is already doing that because the language in the bill is fairly broad and the implementation is quick. So I think there are concerns on the part of rural members, and we've said all along this is a triage of GAMC. I don't know that there's enough money to do the job, but I also have a lot of faith in the providers in Minnesota that they're going to step up and do the best that they can wrestling with this reform that we've put into place and providing good and effective care for the people that show up at the hospitals and clinics.
Representative Dean, talk about the two concerns in your caucus.
Sure. I think there's 2 points that are very important to keep in mind. Number one is that the deal that we have on the table is still the deal that we have, and we need to pass that by April 1st. That's point one, is that the deal we have is still a deal, and it needs to be passed by April 1st. And a separation from what's going on federally, I think, is very important. When you bring up rural facilities, I think that what we're looking at doing is driving the most amount of dollars we can to the places where GAMC patients present, which is a relatively small number of hospitals compared to the whole state. And so we're doing the most we can in the places where they are. Those CCOs that have said that they're interested are going to have to move quickly. We're asking a lot of them, and they are stepping up to the plate by and large.
How about Duluth, Rochester, St. Cloud? Are you going to get no votes from all those representatives? What do you know?
Well, I think that we're going to probably see a very similar vote than when we had the first time coming through. There's broad support for this. We know that we need to pass this. We know that we need to fix it.
Did you guys arrive at any consensus about when the switch would happen to putting patients in MA? Because that would affect how long hospitals would have to live with this current situation, right?
I think it wasn't clear what the timing needs to be, and in part it isn't clear because the details of what the federal government will require for early enrollment isn't clear. But I think we did all agree that the GAMC population, the eligibility criteria for that population, is lower than the Medicaid enrollment population today. So they would automatically be eligible for Medicaid today. The problem is some of the Minnesota Care enrollees might not meet the eligibility criteria for Medicaid.
So as you're sifting through all of this, what does it mean to both the people on GAMC, Minnesota Care, et cetera, and to the providers? Have they been trying to sift through it as well? What are some of the questions and concerns you have?
Well, we would hope that we can get early enrollment working before the end of the biennium, and that would mean more reimbursement for providers. And I think that would be a good thing, because clearly the money in this bill isn't adequate to reimburse providers for their costs.
And really what we're looking at is how do we get from now till 2014? When 2014 comes, the feds, for I believe 2 years, will pay 100% for this population. But how do we get from here to there? And so we have a serious problem with the tails in 12 and 13. And if we can fix that problem, then the GAMC problem goes away. Providers will love it because they'll get higher reimbursements than they currently get with GAMC people. So it would be a great deal for the state if we can figure out how to deal with 12 and 13.
How about consumers, Senator Berglin? Do you have a sense of what this means for consumers out there?
Well, of course, for the GAMC population, at some point, if we can get them enrolled in Medicaid, they'd have more choices of providers, and they would be assured of more continuous service than they might otherwise.
And how about more broadly, Minnesotans who maybe already have health insurance and are wondering how this is going to...
Well, there'd be less cost shifting onto private insurance. I mean, clearly this GAMC bill will require hospitals to do cost shifting, and with a Medicaid type reimbursement, there wouldn't be cost shifting more than there is today.
Yeah, right now, if you have a family insurance policy that's about $13,000 a year, about $1,000 of that goes to cover uncompensated care. So we're already paying for these people. But this bill, because if GIMC ended on April 1st, the people won't go away. They're still going to go to the doctor. They're still going to go to the hospital. They'll still be treated. But then the cost shift to people that have insurance will be much greater unless we can get this problem solved.
Did you talk in this meeting about a potential funding source for the tails?
No. work to be done.
Well, Representative Huntley, you were talking about negotiations yesterday with the governor on the GAMC bill. Have you dropped that notion?
Well, what I was interested in was the early start of medical assistance that Minnesota will be allowed to do and how that fits into the GAMC. And we just came out of the meeting and we have agreed that we'll do sometime this week a fix in the GAMC, that basically the agreements that's already been reached, and that we will continue to work with the governor on how we deal with the change in the federal law and how we fit that in here.
Again, do we think that's likely today or still later this week?
It'll either be today or tomorrow.
Does the governor, did you get any sense in this meeting that the governor is reluctant to have the state do an early part of the federal health care bill because he opposed the bill?
No, they're just worried about the tails issues that it might create. I might add the tails issues that would be created would be less than if there was no GMC changes. But still, we all have to worry about, creating a worse problem for the next biennium.
Yeah, I will say that the governor is very interested in the CCO concept, and he would like to also do what are called accountable care organizations for a much bigger population. That would be an extension of what we did in 2008, and would allow, and that would affect everybody in the state, higher quality care at lower cost.
I think it's important from the perspective of the administration that they've made very clear is that the money that is offered from Washington is not free. It comes with a cost, both in this biennium and next, and particularly in the next biennium, it's quite costly, and we're looking at what the impact is on our general fund in moving forward into 12 and 13, and it's very significant.
Thank you.
Thank you.
Well, the governor invited legislators to meet with him this morning to talk about health care issues, in particular the agreed upon GAMC compromise and the possible impact of federal funding on Minnesota's health care programs and the state budget. We've been talking a lot about these issues over the last few days. As you know, yesterday, Governor Pawlenty sent a letter to Democrats in the House of Representatives asking them to promptly pass the GAMC compromise. As you know, also the governor met with the Speaker of the House and the Majority Leader, the two minority leaders yesterday, and the Speaker indicated that the House of Representatives will be taking up the GAMC compromise today or tomorrow. So we appreciate that. That's important. The current program ends next Thursday, and we want to make sure that per the agreement between our administration and both sides in the legislature that the program is extended. And then we wanted to have an opportunity for legislators to meet with our administration officials. We had officials here from the Department of Human Services and Minnesota Management and Budget to go over the numbers and how some of the bills in Washington, D.C. might impact the state budget. And I think you've seen this chart that I distributed yesterday and that we've provided to legislators as well. And there's some disagreement, as Senator Berglin was saying, but the disagreement essentially is about what's the baseline. And so this chart, and I think, Tim, I don't know if you asked me about this yesterday, I can't remember, somebody did, but what's the baseline for these figures and the chart? The baseline for this chart that MMB put together is if GAMC no longer existed. And they did it that way because the GAMC compromise has not yet passed the legislature, and the program expires on April 1st. So this is a baseline of zero GAMC. The legislators that were meeting with the governor and Senator Berglin and others, they were considering, when you hear them talk about there would be savings, mostly what they're talking about is the savings between the current GAMC program and the GAMC compromise. So that's where those savings, it's what's your baseline. But I think there is broad agreement that there is a significant cost to the state in the next budget period. And Minnesota Management and Budget projects that cost at $881 million. That's $881 million the state doesn't have. And further explanation, that's if the state of Minnesota were to enroll in this Medicaid early expansion program, as they're calling it, up to 75% of the federal poverty guideline. States would have the option under the health care reform bill that was signed by the president to expand up to 133%, but this is calculated on Minnesota going up to 75%. Which would match up with the way GAMC works right now, so it would cover current GAMC recipients. But as you see, there are costs to the state, both in this year, in the fiscal year 2011, there would be a $133 million cost to do that, but that would be largely offset, or more than offset, by a $147 million savings in the Healthcare Access Fund. So this is a savings. We project a $14 million in fiscal year 2011. Now, Representative Huntley looks at it slightly differently, so he has a slightly different number. But then there's this $881 million cost that happens in the next budget period. When you're talking more broadly about possible positive impacts to the state budget, that's the top row, and we're looking at possible impact to the positive of $408 million that is in the jobs bill that is in the Congress right now. Now, that bill has passed the United States Senate, but it has not yet passed the United States House. So, as you recall, in our budget proposal, we had anticipated $387 million from that type of program. So, those are the two, areas that might impact the state budget. It took some time to kind of provide some information, and I think, the agreement is to the legislators are going to continue to work with our agencies to understand those possible impacts, and then we'll move forward throughout the rest of the legislative session. So, I think. Let me see if there was anything else. I think that's kind of the gist of it. So, if anybody has any questions.
What would that number be if you factored in the GAMC compromise?
Well, they're two different numbers. So it's not that would change this necessarily. It's what's the savings between the current GAMC program and the compromised GAMC program. So I don't have that number here. This is a optional federal program. So this entire row, this is if the state chose to be a part of this option under the federal legislation, and if the state did that up to 75%, what would the impact look like? So GAMC, I think they probably provided that data when they passed the GAMC bill. I don't remember that off the top of my head, but the current GAMC proposal versus the compromise, I think the compromise costs, I don't even want to guess at it because I'd probably get the number wrong, but DHS can get you that number. I'm sure they provided that at the time.
And who opts in? Does the executive do that? Is it legislative?
I'm not sure. We were looking at that yesterday, but there are still a lot of unanswered questions. I mean, Senator Berglin had mentioned one of the unanswered questions is, do you have to create a new program, or can the funding be utilized for an existing program? And that is unclear, as she said. I'm just not certain on the answer about who determines. Most of the time when the federal government has optional programs like this, they expect the legislature to weigh in. So I'm not saying I don't know if that's the case here or not, but that's something that we're still looking at.
Does the governor know if he wants to opt in or opt out at this point?
Well, we have concerns. This program could cost the state of Minnesota $881 million in the next budget that we simply do not have. We are already projecting a multi-billion-dollar deficit, and it seems, like you're really piling on if you add another $881 million in costs to that budget. So we have some serious concerns. Obviously at this point we haven't made a decision about what we would recommend, but we are looking at it closely.
Brian, there are only two bills heading towards committee to expand MA eligibility to 75% Did you guys talk about that this morning? What's going to happen?
I think they broadly talked about the concept, but not specifically about the bills, exactly how the bills interact, when they're going to get to, when they tend to move forward. Mostly they're focused on, the expected vote on the GAMC compromise today or tomorrow, and then having a better understanding about the interplay in these federal programs and, whether or not we, might recommend or not recommend to move forward in that area.
Brian, where's the governor on the stadium liquor bill?
I still haven't had a chance to ask him. This came up at the end of the day yesterday, and he went right into this meeting this morning, so I didn't get to talk to him about it. Last year, the governor said that his philosophy at TCF Bank Stadium was, if there's beer for one, there should be beer for all. So that was his position last year. I haven't had a chance to talk to him to see if he still feels that way, or after the experience of one season, if he has a different perspective. But I know that's what he said last year. So I'll check in. I'll try to get you guys an update later today at some point. That's right.
How soon will they meet again, or what happens next on the federal?
I think we're just going to keep working on it. Our agencies, our office, and the legislature. You all should know that, we talk to legislators every day, all the time, not just when they come over and meet and we, come out and talk to you guys. It's a regular occurrence. So our agencies and our staff are in frequent communication with legislators, and I just expect they're going to keep working on this to have a better understanding, and then, we'll be able to take action as needed later in the session.
What's the last question? What's the general tone these days? There's been some conversations going into the next few weeks, and the beginning was a little rough. What's it like these days?
I think the tone has been very positive. The governor had a good meeting yesterday with the 4 caucus leaders. We had a real productive and good meeting with some of the healthcare leaders in the legislature.